Welcome to another in a series of webinars the Workers' Health and Safety Center has been hosting on worker health and safety issues related to COVID-19. We have considered many related issues, but perhaps today's is one of the most important, the worker right to participate in all considerations to protect their health and safety during these unprecedented and challenging times. I am Marty White, a Senior Communications Officer with the Workers' Health and Safety Center. It is my pleasure to be here today talking with you about such an important topic. In this webinar, we will review legal obligations of employers to protect workers, the duty of the Ministry of Labor to ensure this occurs, workers' rights and responsibilities by law, the critical role workers and worker representatives must play in conquering the COVID-19 virus, along with the Joint Health and Safety Committee and Worker Health and Safety Rights and Responsibilities. Throughout the presentation, you will notice we refer to the Joint Health and Safety Committee and Worker Health and Safety reps on the slides with their acronyms JHSC and HSR. The webinar will provide a context for the worker right to participate and what this means. The heart of the presentation then introduces and reviews a new COVID-19 workplace inspection checklist, a tool we hope will assist Joint Health and Safety Committee members or worker health and safety representatives perform their critical role helping to secure working conditions needed to help conquer this deadly virus. Employers and supervisors must take every precaution reasonable in the circumstances for the protection of workers. Reasonable precautions recommended by public health authorities have, since this crisis began, included physical distancing, hand hygiene, cleaning, and disinfecting, among others. Evidence is increasingly suggesting small respiratory droplets can stay airborne for hours. Therefore, use of masks and respirators, especially outside of healthcare settings, along with ventilation considerations, are increasingly finding their way into prevention discussions. Ontario's Ministry of Labor tells us while the COVID-19 situation is changing rapidly, the legislation and regulations used to govern Ontario's workplaces are not. Ministry of Labor has sole authority and responsibility to ensure employers meet their significant obligations to protect workers. To accomplish this, this ministry provides directives to the inspectorate on how to interpret and enforce health and safety law. We understand during this COVID-19 crisis, the ministry has been downgrading work refusals to complaints. To date, only one work refusal has been upheld. Still, we have witnessed outbreaks amongst healthcare providers and residents in long-term care facilities, workers in meat plants and grocery stores, migrant workers in the agricultural sector, and even taxi and limo drivers. So while lack of social distancing in Ontario parks has been met with fines for the perpetrators, there are many instances of workers required to work side by side, in some cases resulting in deadly outcomes. Without a commitment to enforcement and prudent preventive action, will the second wave of COVID-19 we are being warned about by public health authorities see more workers, their families, and the wider community put in harm's way. Ontario's Ministry of Labor tells employers they must assess the workplace to determine how workers may be exposed to COVID-19, develop, post, and communicate COVID-19 policies and plans, implement all reasonable measures to prevent exposures, and consult with the Joint Health and Safety Committee and the Worker Health and Safety Rep. For those who are not immersed in this issue, in workplaces regularly employing 20 or more workers or where designated substances are in use, a Joint Health and Safety Committee is required. At least half of members to the committee must not exercise managerial functions and must be chosen by workers or, where applicable, their union. In workplaces regularly employing more than 5 workers but fewer than 20, the workers or their union, where there is one, must choose a worker health and safety rep who also does not exercise managerial functions. Workers too have a critical role to play during this pandemic. They have won 3 basic legal rights: the right to know about the hazards they face, including the COVID-19 virus, the right to participate, and the right to refuse unsafe work. With the right to participate comes a worker duty to report concerns and hazards and play a role in recommending solutions to eliminate and control hazards. Concerns and hazards should be reported to a supervisor or employer. Also, workers should report them to the Joint Health and Safety Committee or worker rep to allow them to document and track each instance. Equally important, workers have the right not to face reprisal when acting upon these important rights. The right to participate is best exercised collectively through worker members of a joint health and safety committee or worker health and safety representatives. Names and work locations of joint committee members must be posted prominently in the workplace. While the Occupational Health and Safety Act does not specify the need to post the name of the worker health and safety rep required in these smaller workplaces, it is a good practice to do so. Duties of joint health and safety committee members and worker health and safety reps. The rights and duties of these members are spelled out in the Occupational Health and Safety Act. They include recommending the development, implementation, monitoring, and improvement of COVID-19 plan and policies, identify situations that may be of danger or hazard to workers, recommend measures to protect workers, and to follow up to ensure employers have acted on recommendations in a timely manner, particularly important during this pandemic. Employers are required to reply to joint health and safety committees or worker health and safety recommendations within 21 days. During this pandemic, workplaces might consider commitments to more immediate response and action wherever possible. After all, this virus can spread quickly. An outbreak can have catastrophic consequences for workers, their families, and their community. Particularly important amongst the rights of the Joint Health and Safety Committee and Health and Safety Rep is the requirement to inspect the workplace at least monthly. Common practice in many workplaces, however, is for inspections to be done jointly with worker and management. With physical distancing being a concern, workplaces might consider performing the inspection solely by the worker committee member or the worker health and safety representative. With many Ontario workplaces reopening or a growing complement of workers returning to the workplace, consider inspecting the workplace before workers return. This said, it would also be prudent to perform an inspection during regular working hours soon after opening to get an even better picture of potential hazards and to offer workers an opportunity to interact with their rep and point out their COVID-19 concerns and thoughts on control measures. Employers also have inspection-specific duties. They must provide workers performing the inspection with such information and assistance to carry out the inspection. For instance, as we will discuss later, employers will need to provide worker reps with information about the performance of building ventilation systems. To assist with workplace inspections during the pandemic, Workers' Health and Safety Center has developed an inspection checklist. After completing the inspection, and if adequate control measures are not in place to address COVID-19 hazards or concerns, recommendations should be presented to the employer. As previously mentioned, employers should consider committing to immediate action and not wait the 21 days to reply. Workers might also want to consider a plan to track the implementation of the control measures and continue their ongoing effectiveness. If workplaces agree to inspections more often than once a month during this pandemic, this would assist with tracking and assessment, particularly by consulting directly with workers as to whether measures are proving effective. This new checklist is available for download at the Workers' Health and Safety Center's website under the COVID-19 resource page. We encourage each of you to share it widely. There are approximately 70 questions on this checklist, and it's broken down by topic. There are 7 topics: pre-inspection questions, physical distancing, workplace personal hygiene, cleaning and disinfecting, ventilation, personal protective equipment, mental health, illness containment and reporting, along with training and information. Now, as every workplace is different, not all questions will be applicable. It may be that you will need to ask more questions or different questions than we have suggested, but we do think this checklist is a good place to start. The first grouping of questions relate to pre-inspection. Has the workplace COVID policy and plan to implement the policy been prepared with the full participation of the Joint Committee or the Worker Health and Safety Representative? Is the hierarchy of controls driving workplace efforts to eliminate or at least reduce the possibility of exposure to the COVID-19 virus to the lowest extent possible? Has the employer ensured an adequate COVID-19 training? Was the Joint Committee or Health and Safety Rep involved in the development or selection of it, and has it been delivered? And Has an inspection protocol been established to address the issues relating to social distancing and perhaps the provision and use of personal protective equipment? As controls at the source are the most effective, has the workplace considered whether, to the degree possible, that workers can continue to work at home, allowing for more social distancing, or less workers coming into the office? Has the workplace considered restricting access to third parties, clients, which again would assist with social distancing? If you want to learn more about the hierarchy of controls specific to the COVID-19 virus, please be sure to have a look at our webinar we offered on this subject and the precautionary principles some weeks ago. It is posted to our YouTube channel and the PowerPoint to our COVID-19 resource page. The physical distancing checklist. Are there clearly visible floor wall markings to clarify necessary physical distancing? Are physical distancing measures being observed by all in the workplace? COVID-19 training can help prepare workers to play a role reminding customers and others who might enter the workplace to follow these important protocols. If the physical distancing is not achievable, are the following in place? Workstations configured so workers don't face each other? Have partitions and barriers been erected? Grocery stores, pharmacies, and convenience stores were some of the early workplaces to respond to the concerns of workers and their unions by, among other things, erecting plexiglass barriers, otherwise known as sneeze guards, between workers and the public. As we reopen, more workplaces will need to get just as creative in other work settings. Personal hygiene questions. Are adequate hand washing facilities with soap, hot water, disposable towels, and touch-free waste bins readily available? Has clear, highly visible signage for proper hand washing and cough sneeze etiquette been posted at a minimum at all workplace entrances and in all washrooms? You will want to consider all COVID-19 hygiene signage is in English and where necessary languages or symbols understood by all workers and the public should they gain access. Workers need to know they can take time in the day to frequently and thoroughly wash their hands. If in a workplace with public access, consider provisions of touchless hand sanitizers at the entrance and other locations throughout the workforce. Are hand dryers disabled or otherwise out of service to prevent transmission of COVID-19 virus containing droplets? This may not have been top of mind for all to date. Electric hand dryers may end up being a source of transmission of potential virus containing droplets from improperly washed hands or from a person's breath. The potential for this is even greater where the direction of the hand dryer is pointed upward. So during COVID-19, public health authorities are recommending paper towels for hand dryers are the way to go. Cleaning and disinfecting. Are disinfecting products readily available to workers, and are they recommended by either Health Canada or the U.S. Environmental Protection Agency? Are high-touch surfaces cleaned and disinfected frequently throughout the workday? If workstations and equipment must be shared, are they cleaned and disinfected before and after each use? Is an enhanced cleaning and disinfection protocol in place should contact tracing identify exposure to a confirmed case of COVID-19 in the workplace? In addition to regular and thorough cleaning and disinfecting, workplaces will want to ensure gloves and disposable paper towels are available, along with ready access to touchless waste disposal. Workplaces will also want to consider an enhanced schedule to safely collect and dispose of waste that's potentially infected and clean and disinfect waste collection containers. Workers will also want to consider removing clothing potentially contaminated with the virus at work or as soon as they get home and wash in hot water with detergent and dried in the highest temperature setting available. Again, for more details, be sure to have a look at our earlier webinar on cleaning and disinfecting and the related documents on our website. Greener cleaners and disinfectants. Have cleaners and disinfectants been screened for general worker health? In addition to ensuring cleaners are effective against COVID-19 virus, wherever possible, you will want to consider cleaners that are not linked with adverse human health effects. While there is no standardized criteria for green products, The US EPA Safer Choices program compiles a safer chemicals ingredient list. You may also look for safer alternatives through programs such as Green Seal and Eco Logo, which offer third-party certification with strict requirements. No matter what cleaning or disinfecting agents used, workers will need to be trained to ensure they are prepared to use these products safely. We will be posting more details regarding greener cleaners for COVID-19 to our website in the coming days. Ventilation. We are seeing growing evidence that smaller COVID virus droplets and particles can travel greater distances and stay airborne much longer than the larger droplets before settling on surfaces. As a result, some experts believe the evidence is sufficient to warrant enhanced ventilation measures, including increased air exchanges and more clean outdoor fresh air circulating within the system. Airflow should also be considered within the work environment to ensure air from the breathing zone of one person is not being blown directly into the breathing zone of another. This can be impacted by general ventilation, local exhaust ventilation, fans, along with open windows and doors. Personal protective equipment questions. Are there adequate supply of proper PPE? Is it readily available for the circumstances discussed with the Joint Health and Safety Committee or Health and Safety representative? Are workers and other workplace parties using, caring for, and discarding PPE properly? If required, are others, such as workplace visitors and other third parties in the workplace, properly using PPE? All important questions for sure, and especially important in situations where people cannot properly social distance. Consider masks and face coverings. They function, if worn properly, to reduce the number of droplets the mask wearer emits into the air, thereby adding some level of reduced virus transmission. So think of a grocery store or busy transit where hundreds, perhaps thousands, enter the workplace daily, and we see now why some workplaces are asking the public and customers to wear face masks or other face coverings. If workers and other workplace parties don't seem to be using, caring for, or discarding PPE properly, you might consider recommending retraining. For instance, if people are wearing the masks under their nose or resting under their chin, they are defeating the purpose of the mask and putting themselves and others at risk. Mental health. Obviously, this pandemic is creating additional sources of stress in our lives at home, if we care for elderly relatives, if we must commute by public transit, if we require daycare that is currently not available, or it's open and we're concerned with transmission to our kids and our loved ones through the daycare facility. Workplaces might consider a review of all health and safety training to ensure it includes critical learning about the prevention of mental injuries in the workplace, plus support and compassion for those affected. The Workers' Health and Safety Center has just recently developed a new training module entitled Psychosocial Hazards and Workplace Mental Health. It is currently being offered as part of our general stream for Joint Health and Safety Committee Certification Part 2 training, available now in our schedule of virtual training programs. Illness containment and reporting. Also, many important questions should be considered. Is a protocol in place to restrict workers, customers, clients from the workplace if they're experiencing symptoms and or exposed to a person with a suspected, presumed, or confirmed case of COVID-19 or returned from international travel in the last 14 days? Is clearly visible signage in place to help promote these restrictions and consider in a language and or symbols to ensure understanding by workers and others? Workplaces will want to consider consulting with workers and their representatives about privacy issues relating to tracing. Even if the employer has officially designated someone who reports cases to the appropriate authorities, the Joint Health and Safety Committee or Worker Health and Safety Rep will want to assure this is occurring, including the reporting of cases and exposures to the Workplace Safety and Insurance Board. Finally, training and information questions. Have workers and supervisors received adequate COVID-19 training? Again, if during the inspection you note that safe work practices for COVID-19 aren't being followed, you might consider recommending retraining or additional means for sharing safe work practices. Keeping current with public health directives and best practices is also crucial to preventing and limiting transmission. Following the inspection, if prevention solutions cannot be actioned immediately, the Joint Health and Safety Committee or Worker Health and Safety representative should consider recommending a plan of immediate and specific action to the employer. Tracking the implementation of recommended actions and assess ongoing effectiveness is also critical. The checklist we developed has left room for notes to help you record necessary remedial action. During the pandemic, the Workers' Health and Safety Center is offering online virtual training delivered in real time over a secure Zoom platform on specified dates and times. Currently, we're offering our new Hazards of COVID training, GHS WHMIS, and a range of Joint Health and Safety Committee certification training programs. Unlike most training, our programs ensure a highly qualified WHSC trained instructor and all course participants learn together, much like our traditional learner-centered training programs. We have been working from home remotely during this pandemic, but you can still reach us by phone, email, via the internet, and various social media platforms. Thank you all for joining us today. I hope you found this information useful and that it serves to assist as you return to your work and seek to protect workers during this difficult time. If you can please complete the poll that we will be sending you now and submit it back to us, this would be most appreciated. Again, for more information about the COVID-19 virus, the Workers' Health and Safety Center has numerous resources posted to the COVID-19 resource page, and we will be adding more as time goes on. Now we have time, we can take a couple questions from the audience. Now, if I see we are getting more and more questions, we won't be able to get to all of them, and I promise you we'll get back to you directly, or we'll answer them and post them to a Q&A that we'll prepare and post in the following days with this webinar. Bear with me, I'm checking the question that we're receiving now. All right, the first question relates to government direction. Is the government directing employers to develop a COVID-specific policy? Well, the short answer is yes. The government has posted a range of resources to the Government of Ontario website, and they are directing employers to post and communicate COVID-19 policies to workers. They're also offering some insight as to what these policies should address and include, obviously including physical distancing, sanitation, the scheduling of work. The government also recommends that employers consult with Joint Health and Safety Committees into the development of these policies and programs to implement the policies. The next question, does this information apply to all workplaces or only unionized settings? Good question. It's not just the government. The government doesn't just regulate unionized workplaces. They regulate employers for all Ontario workplaces. So this information does apply to all workplaces across the province. Another question. Is the government directing employers to assess the workplace in order to identify potential sources of exposure to the COVID virus and potential sources of transmission? And again, are they requiring the involvement of the Joint Health and Safety Committee or Worker Health and Safety rep? The answer is yes and yes. Again, these directives come from the Ontario government in their various resources that are posted on their website, the resources specific to COVID-19. And again, specifically, employers must assess the workplace to determine what they need to do to protect the health and safety of workers. And the employers, and the government's requiring and suggesting that employers assess the workplace in consultation with the Joint Health and Safety Committee or health and safety representatives. many questions about government requirements and government oversight during the COVID-19 crisis. Is the government requiring employers to provide COVID-19 training? The government is not specifically mentioning the term training in their many resources, but they are reminding employers of their many duties, such as protecting workers from hazards posed by infectious diseases, including the COVID-19 virus. Obviously, the general duties, providing workers with information, instruction, and supervision to protect the health and safety of a worker, and also the general duty clause that workers or employers and supervisors are required to take every precaution reasonable in the circumstances for the protection of workers. Further still, in order for workers to be able to act on their right to participate in the duty to report uncontrolled hazards, including the COVID-19 virus, they, along with worker reps and supervisors, need proper training in hazard recognition and what measures should be in place to eliminate or control them. To meet these requirements, workplaces might consider the new Worker Center COVID-19 training that offers a comprehensive look at how the virus can be transmitted in the workplace, sources of exposure, measures to eliminate exposure or control transmission, and many other aspects of operating safely during this crisis. Check for other questions. Okay, should joint health and safety committees meet more often than once every 3 months as long as the COVID-19 crisis continues? Excellent question. Just as many have suggested enhanced inspection schedules throughout this COVID-19 crisis, workplaces might consider joint committee meetings more often. That is more often than once every 3 months. Again, you might want to consider as well, where social distancing is a concern, you might want to host meetings virtually. Workplaces will also want to consider additional time for worker health and safety reps to perform their functions during the COVID-19 crisis. All right, again, I've noticed we've reached the 30 minutes. So I'd just like to take this opportunity again to thank you for participating today. And again, hope that you'll access this important resource that we've created, this joint health and safety inspection tool that's on our website under the COVID-19 resources. And please share it widely, and all the best when you return to your workplace, and stay safe.